Well, Professor Nicholls, I wanted to ask you first of all, what it is that you see as being sort of the key things in mental health in both Canadian correctional systems and internationally as well.
I think one of the key findings from the work that we've done recently and that we presented at the conference earlier today is the importance of embedding a comprehensive model that reflects screening at admission to the institutions and includes triaging to make sure that people get urgent care, that we're attentive to serious mental illness, but that we're also thinking about preventing adverse events like victimization and violence, suicide, non-suicidal self-injury, for example. And then that translates into assessment and intervention and ultimately into reintegration. And so we refer to that as the Steyr Model.
The Steyr Model, that sort of pathway through. And can you tell me a little bit about how the various stages of that sort of interrelate?
So as I sort of elaborated on with respect to the screening piece, you want to make sure that it's done immediately at admission to the institution, preferably within hours. Some guidelines even recommend within minutes. I'm not sure that's feasible for some agencies. But you want to make sure that every inmate is seen and that it's done at admission before the individual goes to a living unit, for instance. That then translates into a triaging piece. So typically, at least within the British Columbia system in Canada and in Ontario, where they've adopted a similar approach, the screener then makes a referral to a mental health coordinator, somebody who has mental health expertise with respect to assessment to some degree. That might be a psychiatric nurse, for instance, or a master's trained clinical psychology student, for example. And those individuals then will follow up and visit with the inmate. They'll touch on the issues that maybe came up in the initial screening intake interview and make a decision about whether or not that individual then needs to be referred for a fuller assessment.
Okay.
So the A in the Steyr Model is the assessment piece, and that would include, for instance, a referral to a psychiatrist or a psychologist, for example, with respect to perhaps psychotic symptoms, substance use disorder. It could also include a referral to a GP if there were, for instance, withdrawal circumstances and symptoms that needed to be attended to. And then I think where we can probably improve on the work that we're doing internationally with respect to the care of individuals who come into the criminal justice system is making sure that the good work that happens at the front end then translates into interventions and supporting individuals and reintegrating into the community. That can be challenging, especially within a remand setting where you have people often who have very short lengths of stay. So you don't have a lot of time for planning and preparation, and that makes that screening piece even that much more fundamental, because you want to start those processes early, make those relationships to the community early on, and support the inmate as quickly as possible. But I think that's really fundamental to preventing the cycling of individuals, not only within the criminal justice system, but also to other health agencies. Homelessness is a chronic problem in this population. We know, for instance, that mentally ill individuals are actually about 13 times more likely to be victimized than they are to perpetrate violence. And so we want to be thinking about keeping people with serious mental illness safe when they return to the community.
Yes.
Absolutely.
And you said in the masterclass this morning some people who cycle through the system multiple times as well.
That's absolutely the case. So one of my PhD students, Ms. Amanda Butler, is actually looking at a really comprehensive data set from the BC Correctional Health Authority, and we have 166,000 health assessments, and what we're seeing is that over a 10-year period there's a range of between 0 and as many as 77 readmissions.
Yeah, that's a lot, isn't it?
It is.
So if you had to highlight for people maybe say 3 areas within the Steyr Model that you see are of fundamental importance, people to translate into practice, what would those 3 areas be?
I think the first piece would be around the universality of the admission screening. So very much like we think in healthcare about the importance of hand washing and trauma-informed practice. We don't need to know that somebody's experienced trauma to make sure that we integrate trauma-informed care in our interventions and our services. In the same way, we just anticipate that every inmate needs to be seen because there is a risk that they may present with illness, substance use problems, or associated functioning and day-to-day living challenges. I think the other piece, as I said, we haven't done as much work around the reintegration component. So we've seen some excellent presentations here on the Engager model at the conference, and what I understand, not only from what's happening in the literature more broadly, but from that study in particular, is we really want to be thinking about what can we do with different populations to support safe and effective reintegration into the community. And we don't know always what works as well with whom, and I think it's a piece that we need to really be building on.
So it's those areas of transition, isn't it, really, that are key right at the front end with coming in. You said really screening, it's a universal thing and it has to apply to everybody, and then at the back end it's the transition back out into the community.
Yeah, I think that's absolutely one of the integral challenges that we're facing presently.
And that's an area for further research for you?
Absolutely. We're looking at investigating the application of the Steyr model as a full model to inform a systems approach to caring for individuals with mental health problems in correctional settings. And so we'd like to see how the application of the entire model works and improves care.
Good. Well, I wish you every luck with that. Thank you very much for your time.
Thank you so much, Luke.